What I'd like you to do is, when you go back to your practices on Monday, starting Monday morning and for the entire week, is have a notepad or a legal pad at every workstation, at every phone, and in every operatory. And take the week to jot down every single question that your patients ask you. Every single question that a patient asks. And then at the end of the week, have somebody within the office compile those questions and put them together, because you're going to get repetitive questions. This sounds like a nuisance, but it's actually very effective in training you how to talk for the doctor. If you know what your patient's questions are, then the doctor can answer them. And what we want the doctor to do is to sit down and write an answer for every single question the patient asks, briefly. If you've got a C-type doctor, they might write you a whole page. We want just two or three sentences that the doctor wants you to say. Now, with the computer, you can now put in the paper that has the, in the past we would get you to get a 4x5 card, index card, and fill these cards out. Now you can actually run them off the computer and you can generate them all at once. So type them in once and you're done. So it's really pretty quick. And what the responses from the doctor then, you will at this second hour do role playing. And you'll talk about, you can ask the doctor, the patient said, what are the benefits of a crown? How would you answer that question? Just simple things so that we start our staff talking for us. If we look at how much a doctor talks, if they talk 7 minutes to every patient and they see 30 patients in a day, that boils down to 3 hours, 3.5 hours of talking over the course of a day. If you can talk for the doctor and the doctor's comfortable with what you're saying, you can save the doctor a lot of time. And this is one of the things, though, it's very hard for some doctors to turn over. And yet, you can really gain a lot of office productivity. I would rather see the doctor at the chair with a drill in their hand than talking to a patient. How many have worked for a doctor that talks and talks and talks at the chair? And you get the patients behind. We get the patients behind, don't we? And then the patients are waiting, and I talked this morning about broken appointments. The #1 reason for broken appointments is the patients are kept waiting and we don't respect the patient's time.